So I'm the Chief Medical Officer for England, and I advise the UK government on all things medical and represent the UK internationally on global health issues. Typical day actually varies, but 2 days a week I get up and go jogging with a friend for an hour, and then I get the bus to work, and then there's a series of meetings usually about public health, science and science into policy, and my team bring me all sorts of papers that ministers are going to read to get me to have a look and opine on what I think about them. And of course there are meetings with ministers and external people. So it's always hectic, it's always long, there are many work dinners, but every day is different. I was good at biology at school, and I was fascinated by the double helix and genetics. So I wanted to do medicine. It was not the commitment that young people have to make now. I just decided when I wrote out my university application form I'd do medicine. Well, in my day, of course, if you were a woman in medicine, you had to be better than the men. And there has been a glass ceiling, which I've shattered on a number of occasions. I'm the first woman CMO in 165 years. But the other issues are the issues we all face. How do you combine two careers? That of myself and my husband. How do you combine careers and children? And do you want to do academic medicine or clinical medicine? And then, of course, I've ended up a public health doctor. Our lifestyles, bad lifestyles, are most dangerous for our health, and you could choose obesity, which is about eating too much, lack of physical activity. I mean, physical activity and exercise has to be the magic bullet to prevent all sorts of nasty things. Then, of course, as a nation, a number of us drink too much, let alone smoking, still a major cause of death in this country and disability. All microbes can, as part of Darwinism selection of the fittest, develop spontaneous mutations that mean they don't respond to drugs. And these drug-resistant infections are often called antimicrobial resistance, AMR. And it can happen in bacteria, in malaria, TB, HIV, in all microbes, fungi as well. And the concern that we all share across the globe about this is that resistance is going up, and we're not doing enough both to prevent infection or to produce enough new treatments. In fact, we've had no new major chemical entities for antibiotics since the late 80s. So we're running out of drugs, and increasingly the infections are resistant to what we've got. We are finding cures for cancer, but they will be much more individualized as we go forwards, involving both chemotherapy and immunotherapy. That is, turning the body to fight the cancer itself, as well as radiotherapy and surgery playing roles. So we live in an exciting time, but there won't be a universal cure. There is a universal prevention, which is not being obese, not drinking too much, and taking physical activity. That reduces all our risks dramatically. Like many women, I have and do suffer from the imposter syndrome, and I would say have the confidence to put your hand up and go for things. And actually, what I often tell young people is I have taught myself to metaphorically hold my nose and jump, and it's always worked.
Racism has a very old history, and interestingly, racism has also changed over time.